the Swedish strategy or policy is a bit different from what we have heard from Spain and Germany. So I will start to explain, so to say, the setup in Sweden. Next slide, please. Thank you. So the Swedish Development Cooperation is governed by the Swedish government policy and reform agenda for development assistance for a new era decided by the government in 2023. So this policy is implemented by the Ministry for Foreign Affairs, mainly through provision of core support to multilateral organizations and international financial institutions. The Swedish International Development Cooperation Agency, SIDA, and a few other government agencies are governed by annual appropriation letters and multi-year strategies that can be thematic or geographic. SIDA implements these strategies by providing project, program, or flexible forms of support or guarantees to NGOs, CSOs, multilateral organizations, academia, public-private development partnerships, and through dialogue with partners. Next slide, please. The reform agenda for development assistance has some overarching and thematic goals. So this is not specific for health, it's specific for the whole development cooperation of Sweden. So the overarching goals are to create preconditions for better living conditions for people living in poverty and under oppression. That it should be a foreign policy tool to pursue and protect Swedish interests and to promote a long-term perspective, effectiveness, and results. There are 7 thematic goals, of which one is improved health for the most vulnerable. There are geographic priorities, Ukraine and the EU's eastern neighborhood, as well as bilateral cooperation in a maximum amount of 30 countries spread in all regions. The financial frame is 56 billion Swedish kronor per year during 2023 to 25, and in 26 it decreases to 53 billion Swedish kronor per year, and this is for development cooperation as a whole. Deductions for costs for receiving asylum seekers and people in need of protection in Sweden are limited to maximum 8% of the ODA budget for each year. Next slide, please. So if we zoom into health, within the thematic priority, improved health for the most vulnerable, there are 3 specific priorities: better conditions for good health and strengthen health systems, prevent and combat health threats, including pandemics and antimicrobial resistance, and sexual and reproductive health and rights. In area 1, that you can see summarized on this slide, includes to contribute to health initiatives for the most vulnerable, especially in humanitarian emergencies, resilient health systems, sustainable financing, including anti-corruption, research, innovation and digitalization, and disease prevention and health promotion. Next slide, please. Area 2 includes to contribute to strengthen preparedness against health threats, enhanced local capacity to manufacture vaccines and medicines, increased awareness, dissemination of factual information to prevent and respond to health threats, combat antimicrobial resistance through a One Health approach, and access to water, sanitation and hygiene. Next slide, please. Area 3 on SRHR includes combating all forms of sexual and gender-based violence and harmful practices, integrating SRHR services into health systems, increase access to trained staff, particularly with midwives, and adequate care of pregnant women, mothers, and newborns. Improve access to comprehensive sexuality education, modern contraceptives, and safe and legal abortion. Next slide. Yes, health and SRHR have been profile areas for Swedish development cooperation for decades. Sida's activities include a combination of support for capacity building, for example, introduction of the midwifery profession, and comprehensive sexuality education and health system strengthening. Healthcare services including contraceptives, vaccines, maternal, child and adolescent health care, and SRHR. Research and innovation including research collaboration and research capacity building. Advocacy for the right to health, human rights and gender equality, and sexual and reproductive rights, including the right to safe abortion care, as well as linking climate and environment to health. Innovative financing and collaboration with the private sector, including guarantees and social entrepreneurship. Next slide, please. Sida provides health and SRHR assistance in approximately 20 countries distributed in all regions, and we support bilateral health and SRHR programs in Afghanistan, Bangladesh, the Democratic Republic of Congo, Myanmar, Palestine, Somalia, Ukraine, and Uganda. In addition, there is a regional SRHR strategy for Africa, implemented from a regional team based in South Africa. SRHR is also included in in all regional strategies to varying degrees. In addition, there is a dedicated thematic global strategy for health and SRHR, and health and SRHR is also included in the global strategies for research cooperation and humanitarian development cooperation. Next slide, please. The new strategy for Sweden's development cooperation for health and SRHR for 2025 to 29 was decided by the Swedish government in December last year, and includes the following priorities that are in line with the reform agenda for development cooperation. Strengthen conditions for good health, strengthen capacity to prevent and combat health threats, and greater enjoyment of sexual and reproductive health and rights. The budget for this strategy is 4.3 billion Swedish kronor for the 5-year period. Despite having a global reach and added value, there is an increased focus on results at country level. Synergies with results from regional and bilateral strategies should also be sought, as well as collaboration with the Swedish resource base, including the business and private sector. Digitalization is a new area of engagement, and the strategy is currently being operationalized by Sida. Next slide, please. I will now briefly present some statistics from the implementation of the reform agenda focused on health that came into force in 2023. The total health aid in that year amounted to 5.7 billion Swedish kronor, 61% through the Ministry of Foreign Affairs and 39% through Sida. It corresponds to 10.4% of total Swedish ODA. Next slide, please. The core support to multilateral organization corresponds to 85% of ODA from channeled from the Swedish Ministry for Foreign Affairs. The largest recipients were the Global Fund, World Bank, UNFPA, Gavi, UNICEF, vaccine donations, UNAIDS, EU, IVI, and WHO. Although the core support to WHO is managed by Sida. Next slide, please. In 2024, Sida dispersed approximately 1.9 billion Swedish kronor to global, regional, and country programs for health, including SRHR, which corresponds to approximately 7.3% of the total development assistance managed by Sida. We also dispersed approximately 1.3 billion Swedish kronor for SRHR, which corresponds to 5% of Sida's disbursements. Since the pandemic years, support to health has decreased and is lower than before the pandemic. Next slide, please. The majority of development assistance in health and SRHR is implemented at country level, corresponding to 44%, followed by global thematic 28% and regional level 27%. Geographically, the highest number of programs in health and SRHR were carried out in Africa. And there are also countries in Asia in the top 10 largest receiving countries. Next slide, please. The largest partner categories are multilateral organizations, followed by non-governmental organizations and civil society. Less than 10% is dispersed through public sector, academia, or public-private development partnerships. The largest multilateral partners for SIDA are UNFPA, WHO, and UNESCO, while the Clinton Health Access Initiative, Save the Children, IPPF, and IPAS are the largest NGO partners. Next slide, please. Team Sweden consists of many parts of the Swedish resource base. At present, in the area of health, the core actors are the Public Health Authority, the National Board of Health and Welfare, which is the main Team Sweden partner in health cooperation in Ukraine. Different Swedish universities, and SIDA and the Ministry of Foreign Affairs. Sweden, mainly through SIDA and the Public Health Authority, are engaged in 3 global health TEIs, the one on SRHR, public health institutions, and MAV+. Next slide, please. So to conclude, the EU Global Health Strategy is still relevant and very coherent to the Swedish priorities, but must be seen in the light of recent changes in the global ODA landscape. A push for domestic accountability should be at the core. The EU could focus more on its catalytic role. And there is, as I said, relatively good alignment with the Swedish Global Health Strategy, but also complementarity. The Swedish strategy focus maybe more on bilateral support and support to civil society. Swedish key priorities, to summarize, are geographically Ukraine and the Eastern neighborhood, thematically sexual and reproductive health and rights, health threats, including pandemic and antimicrobial resistant preparedness, and health system strengthening, as well as humanitarian support. Challenges that we see is the pushback against human rights, gender equality, sexual and reproductive health and rights, and climate change, challenging financial times, the demographic changes, and growing burden of non-communicable diseases, including mental health. But the opportunities, of course, are closer collaboration to become more strategic and coherent within Team Europe. Thank you very much.